So, good afternoon, everyone. I'm Natalia Palmier from the Dental Oncology Service at the São Paulo State Cancer Institute. I'd like to thank the committee for asking me to present this lecture entitled Awareness of the Risk of Radiation-Related Caries in Head and Neck Cancer Patients, a survey of physicians, dentists, and patients. First of all, head and neck cancer, as you all know, is an important worldwide health issue, with most cases being diagnosed with 90% of squamous cell carcinoma, and patients submitted to multimodal treatment, including surgery, head and neck radiotherapy, chemotherapy, and target therapy. Although radiotherapy is important for tumor treatment, it comes along with several side effects. So we can have acute toxicity such as oromucositis, dysgeusia, trismus, infections such as oral candidiasis, radiodermatitis, dysphagia, and chronic side effects such as xerostomia and hyposalivation, radiation-related caries, and osteoradionecrosis. First described by Del Rigato in 1939, radiation-related caries is an aggressive type of tooth decay promoting generalized tooth structure destruction, loss of masticatory efficiency, and persistent infection. It usually starts within the 6 to 12 months post head and neck radiotherapy, affecting 29% of patients, up to 37% of these patients after 2 years of the conclusion of radiotherapy. Usually, most of head and neck cancer patients present poor overall health status, with poor oral hygiene, caries, periodontal disease, multiple dental loss that need to be treated before the treatment. When it progresses, radiation-related caries represent an important increase in treatment cost that can vary from $192 to up to $78,000 when bone reconstructions are required for the management of osteoradionecrosis caused by tooth extractions due to radiation caries. Here in this image, you can see a patient prior to the beginning of the treatment for oropharyngeal cancer. And in the letters C and D, the same patients after 1 year of radiotherapy with generalized tooth destruction, loss of most of the teeth, and teeth with fractures. The etiologic factors for the development of radiation caries is still very controversial. Some studies report that radiotherapy represents a direct effect on the tooth structure, although most of these studies are performed in vitro with non-normalized radiotherapy applications. The most accepted theory is the cluster of oral symptoms that englobes oral mucositis, radiodermatitis, oral pain, dysphagia, hyposalivation, dysgeusia, and fatigue caused by radiotherapy, and dehydration and nausea and vomit by chemotherapy protocols. This will lead to the patient's dietary adaptations, the pain in oral mucositis. Patients have difficulty in perform adequate poor oral hygiene, leading to insufficient oral hygiene, increasing carcinogenic microorganisms, altering salivary pH, and impacting the saliva buffer, leading to accelerated demineralization of enamel and reduced remineralization, favoring the development of radiation caries. Radiation caries present several different aspects from conventional caries. It usually starts with the progression of enamel cracks, as we can observe in the top image. We can observe by transillumination of the teeth several cracks, both on the vertical area of the tooth. It follows with blackish brown color alteration, enamel fracture, and delamination, exposing the dentin, which is a tissue that is more prone to the effects of bacteria, exposing this tissue to a highly carcinogenic oral environment, favoring the rapid progression of the caries. It usually affects the incisal edges and cervical areas, progressing in an axial transversal way, leading to dental crown amputation, with the remaining roots exposure to the oral cavity, being prone to further infection. Radiographic features, we can observe that although some caries can clinically present as incipient or initial caries, by tomography, we can observe that it already represents an important destruction of the tooth structure. Here on the right images, you can observe a patient prior to the beginning of the treatment, and the last panoramic radiograph, 2 years after the treatment, the patient lost all his teeth. So far, there are no clinically validated scales for the diagnosis and no clinically validated protocols for the management and diagnosis of radiation-related caries. Recently, our group published this suggestion for a new clinical guide for the diagnosis and management of radiation caries, including patients that are at risk of the development of radiation caries. They are all patients that are submitted to head and neck radiotherapy protocols, patients that present initial clinical form of radiation caries, patients with established stage, which are the patients with loss of tooth structure and dentin involvement, and advanced stage where the tooth presents intense destruction and dental crown amputation. So far, our radiation caries still poses as a major challenge for multi-professional teams in the oncology setting. Studies have shown that radiation caries is an important oral toxicity and is unknown by most of the patients. It is usually misdiagnosed by dentists and poorly identified both by dentists and patients, leading to inefficient treatment. Studies report that lack of awareness can affect the course of a disease and consequently its prognosis. Therefore, awareness is essential to encourage more proactive behavior throughout disease prevention and health promotion. Here in this image, we can observe a generalized blackish brown color alteration of teeth post-radiotherapy, and in the second image, the loss of dental enamel with exposure of the dentin to the oral environment. This was a collaboration between the dental professionals of the Piracicaba Dental School, University of Campinas, and the Dental Oncology Service of the São Paulo State Cancer Institute, which aimed to investigate the level of awareness of radiation-related caries among physicians, dentists, and survivors of head and neck cancer. We divided the patients in 3 groups: physicians, oncologists, head and neck surgeons, radiation oncologists, and general practitioners, dentists, general practitioners, oral medicine specialists, and oral oncologists working in cancer centers, head and neck cancer patients treated with head and neck radiotherapy for oral and oropharyngeal squamous cell carcinoma. All patients were instructed, both verbally and in written form, of all the adverse effects of head and neck radiotherapy. Patients were also followed daily during the treatment, and during the treatment were again advised about the adverse effects of radiotherapy. A total of 124 physicians were included and were divided in two subgroups. Group 1A, 64 specialists in the oncology area and 60 general physicians. The questionnaire with 8 questions was applied using the SurveyMonkey platform. Here we can observe that less than half of the physicians related to be aware of the concept of radiation-related caries. And physicians with specialize in the oncology field, only 50% reported, only 78% reported to be aware of this disease. 20% have no awareness of what is radiation caries. Most of the physicians did not answer correctly the time for the development of our of radiation caries, less than with only 46.77% getting the answer correctly. Again, the percentage was slightly higher, the correct answers, yet it for the oncologists it was lower than for general physicians. 3% of the physicians that works on oncology field did not advise the patients to be evaluated by a dentist. This is very important because although this result is small, only 3%, it proves to us that we need to reinforce that the physicians work alongside the multi-professional team. Again, 28% of the oncologists in head and neck and radiotherapies did not advise the patients about the development of radiation caries. And 6.25% did not believe that radiation caries could lead to the development of osteoradial necrosis. Following to the dentist questionnaires, a total of 280 dentists were answered the questionnaire, with 160 specialists in oral medicine and oral oncology field and 120 non-specialists. Dentists were required to answer a 13-question questionnaire, also applying using the SurveyMonkey platform. We can observe that 81% of the dentists replied as aware of the concept of radiation caries. Nevertheless, only 37% of the specialists and overall 34% of the dentists got answered correctly the time for the development of radiation caries. Additionally, 10% of the specialists did not answer correctly the question, do you believe that radiation caries can be more aggressive than conventional caries? And considering that this is the main clinical feature of radiation caries, this is a really interesting result. Less than half of the specialists answered correctly the percentage for the development of radiation caries. Most of the dentists, however, answered correctly the topography for the development of radiation caries on tooth structure. 4% of the dentists specialized in the oncology field did not advise the patients about radiation caries. This is a really important result again, because us from the dental oncology field, our main work is during the after the treatment is to prevent and treat radiation related caries. So we have almost 5% of specialists that do not orientate the patients about this condition. The enamel cracks, which is the main initial feature for early diagnosis of radiation caries, almost 40% of the specialists did not know about this clinical characteristic of radiation caries. And 20% of specialists did not believe that radiation caries could lead to osteoradionecrosis. And here we have that the most important etiological factor for the development of osteoradionecrosis is tooth extraction due to tooth destruction, mostly caused by the progression of radiation caries. So we have, and 15% of the dentists reported that they believe the restorative treatment for radiation caries is the same for conventional caries, which this is not accurate. The treatment for radiation caries usually fails within 2 years, while conventional caries can last over 10 years. Finally, the patient's results. A total of 58 patients were evaluated with a questionnaire with 7 questions, which was applied by the same trained dental surgeon between the 6 and 7 weeks of head and neck radiotherapy. Most of the patients, over 75% of the patients from all groups, referred to not be aware of what is the concept of radiation related caries. Here, we divide the patients in 3 subgroups. The first is the level of education, where we have patients with low level, medium level, with incomplete high school or a complete higher education, and patients with complete university education. Also, they were divided by the cancer stage in early or advanced stage of disease, and finally by the number of teeth present in the oral cavity. Patients that presented up to 17 teeth and patients with more than 18 teeth present in the mouth. In terms of if the patients believe that radiation could affect the tooth structure, we have that most patients that presented higher level of education, early stage of disease, and higher number of teeth in the mouth answered the question correctly. Over 50% of patients refer that they were advised by the oncologist and the physician's team about the radiation related caries as an effect from radiotherapy. And the same patients referred that they were also advised by the dentist about radiation caries. Most of the patients referred that hyposalivation could increase the risk for the development of radiation caries. This result shows that patients, since the beginning of the treatment, present with hyposalivation and xerostomia, and they connect these alterations with the development of tooth decay. Finally, most of the patients, when asked about osteoradionecrosis and bone infection due to radiation caries, referred that they believe they could be correlated. To our knowledge, this is the first study that evaluates the level of awareness of radiation-related caries from the perspective of physicians, dentists, and patients. As we could observe, the lack of awareness by the physicians could compromise the safety of the patients and expose them to serious problems that could be prevented if early diagnosed. Over 50% of the physicians from both the specialists and general physicians groups answer wrong the correct time for radiation-related caries development. As I mentioned before, it's well known that in the literature that the development of radiation caries occurs in the first 6 to 12 months post head and neck radiotherapy. This lack of knowledge could lead to delay in radiation caries diagnosis and increase risk for its complications such as osteoradial necrosis. Most of the dentists refer that they were aware of what is the concept of radiation-related caries. This could be due the increased dental care programs for patients with head and neck cancer that have been well documented in the literature. However, the answers were answered in a heterogeneous way. So the knowledge of radiation-related caries varied between the groups of dentists, reinforcing the need for better education of dental professionals on the unique aspects of radiation-related caries and how to best manage patients with head and neck cancer undergoing radiotherapy. As I mentioned before, 25.35% of the dentists did not believe that radiation-related caries could lead to osteoradial necrosis. This lack of knowledge could lead to inappropriate treatment that could affect the course of the disease, leading to important complications of radiotherapy. 75% of the patients were not aware of the concept of radiation-related caries. This lack of patient awareness may be explained in part by the inadequate education of health professionals, as we could observe by the results of both physicians and dentists, who do not educate correctly the patients on the side effects of the treatment and also the lack of interest in the problem by part of the patients. This is important. We have a patient that has recently received a diagnosis of cancer. It's mostly scared. There's a lot of things happening at the same time. And for most of the patients, the thief is something secondary in this moment. But unfortunately, if we do not treat this patient, the oral environment, prior to the treatment, the consequences can be very severe and lead to decreased quality of life of these patients. Patients with higher level of education, early stage of disease, and greater number of teeth in the oral cavity answer more questions correctly. This suggests that patients with improved cognitive skills or improved oral health status may be more prone to pay attention to instructions regarding dental complications of the treatment and maintain good oral health and dental health throughout the treatment. Nevertheless, most of the patients from the present study represented a remarkably higher lack of awareness comparing to studies in the literature where the patients were advised about radiation complication with educational video. This reinforced the need for better strategies for the delivery of information regarding possible complications of head and neck radiotherapy. Awareness is essential to encourage proactive behavior related to disease and promote health, both by the medical team and the patients. Studies have shown that without close interdisciplinary cooperation and communication gaps may occur between physicians, dentists, and patients, and this lack of communication might increase the risk for complications of the treatment. Additionally, studies suggest that patients' dental behaviors are more positive when recommendations are delivered by the oncology professionals. They listen more to the medical team. So we need to work together in order to provide better treatment for these patients. As conclusions of the present study, we can infer that patients with head and neck cancer had limited awareness of the concept of radiation-related caries. Despite the percentage of correct answers, the heterogeneity of answers among physicians and dentists may be an important factor in how the information is presented to patients and caregivers. The lack of awareness impairs the provision of accurate information to patients, consequently affecting patients' understanding of radiation-related caries. Therefore, strategies for further dissemination and better communication between healthcare providers and patients, in addition to measures to prevent radiation-related caries, must be established to provide the best care for these patients. Here I brought the statement of clinical relevance of the published manuscript, which reads, radiation-related caries may be considered a forgotten oral complication of radiotherapy. Lack of radiation-related caries awareness by physicians, dentists, and oncology field could impair the provision of accurate information to patients, consequently affecting patients' understanding of radiation caries. So this is really important. I've been working in the field in over 6 years, and patients develop a lot of radiation-related caries and followed by osteoradionecrosis. Uh, I brought this work, and I thank the team for letting me present this work because I believe this is really important to the best care of head and neck cancer patients. I thank you. I thank the co-authors of this team of this work and the São Paulo State Cancer Institute and the Piracicaba Dental School, University of Campinas. And here is my mail. Thank you all for the attention, and I'm open to questions.